Good afternoon. Thank you for being here. In a few minutes, I'm going to turn over our conference to Dr. Rambod Rouhbakhsh. He is the Assistant Director of the Forrest General Hospital Family Medicine Residency Program. After Dr. Rouhbakhsh gives his remarks, then Dr. Rouhbakhsh and Dr. Steve Farrell, who is our Chief Medical Officer here at Forrest General, will take questions. Following those questions, I will introduce Mayor Toby Barker and also David Hogan, President of the Forrest County Board of Supervisors. We have provided to you a media packet with press release information which you can reference for the correct spelling and titles. Dr. Rouhbakhsh.
Thank you everyone for coming. I'm going to read a prepared statement, and as Millie alluded to, we'll be open for questions afterwards. So yesterday we received confirmation from the State Department of Health that a Forrest County resident tested positive for the coronavirus. The patient came back to Hattiesburg on Monday after traveling out of state to Florida. Early Tuesday morning, the patient started showing signs of fever, cough, and muscle aches. The patient presented for treatment at one of our clinics, at which point nasal and oral swabs were obtained and submitted to the state lab for testing for the coronavirus. Prior to coming into the clinic, the patient called ahead and was gloved and masked to help prevent the possibility of spread to patients and healthcare workers. The patient was subsequently sent home for self-quarantine. Late yesterday afternoon, we were notified by the state lab that the test was presumptively positive for the coronavirus and was being sent to the CDC for confirmation. We notified the patient of the test results, and as of this morning, the patient is doing well and at home. I'm going to pause for just one quick second here to underline how exactly perfect this patient handled this interaction. Had it not been called ahead of time, had we not been prepared with masks and gloves, it would have been a much greater exposure. The patient also traveled with a companion who came into another clinic where nasal and oral swabs were received and submitted to testing. At this time, we're awaiting those test results. We want to thank that patient for calling ahead and presenting, and we wish him a speedy recovery. At Forrest General Hospital, we have sent a total of 3 samples for testing to the state lab, all of which have come back negative. Per the CDC, the symptoms of coronavirus are fever, cough, and shortness of breath. Similarly, typical symptoms of the flu are cough, congestion, fever, sometimes shortness of breath. For perspective, in 2018, we treated 1,642 confirmed flu cases. It is likely that patients with these symptoms have an illness other than COVID-19. Nevertheless, we were aware that cases would eventually come to our state, and we've been preparing for weeks and are ready to care for our patients. We will get through this. We're asking the public to remain calm. Due to outbreaks overseas and the national attention, supplies for personal protective equipment are in short supply. These are things like masks, gloves, and gowns. Due to the short supply, we'll be limiting the number of visitors inside our hospitals. Starting today, we will limit 1 visitor per patient until such time shipment of supplies starts flowing again. We ask for your patience during this time of heightened concern. My partner, Dr. Steve Farrell.
Hi, we'll be happy to take any questions at this time and address any of your concerns.
I have a question. Is the administration demanding that their staff and nurses remove masks when the employee wants to wear a mask for their own personal safety? Is there a policy, whether official or unofficial, that employees should not be wearing masks on the floors or in patients' room and they feel they need to?
So there is a very well-established scientific basis on when to wear personal protective equipment, and we are following those guidelines. It is not an independent choice, and it is not up to independent choice because the choice that is then usually made out of fear, out of their own fear. We do not wear a mask out of fear. We wear a mask and protective equipment because it's scientifically based to protect us and the other people around us. We do not allow our employees to wear personal protective equipment when it's not appropriate. And we have very well described policies that address that, and we provide them the equipment and the information they need to be able to do their jobs appropriately. Personal protective equipment at this time across the country is in very short supply. We cannot use personal protective equipment off the cuff. It has to be used appropriately. And we are using a very well-established policy to guide our usage of that.
How many ICU beds do you guys have available at this hospital?
We have 48 beds available.
Could you define the difference between a presumptive case and a confirmed case?
So the initial test goes to the State Department of Health, and they gave us the diagnosis that came back positive. The affirming test, the confirmation test is done at the CDC. So they do a secondary, more specific test to make sure.
Also, is there anything that would help you to conclude that this individual contracted the virus because he was in contact with someone else, or that he actually got it while he was in Florida?
So it's a really good question, and I think it alludes to what a lot of the fear is what's my risk with exposure. So what we know about this virus is the incubation period can range between 2 and 14 days, with a median of about 5.1. So based on individual patients coming up positive, we tried to then detect what exposure was. So after this patient was diagnosed, we got on the phone with the state epidemiologist, Dr. Paul Byers, whom you guys may have seen about an hour earlier, and we tried to figure out who was at risk of exposure. So we know the infectivity of this virus, of this illness, is highest in the first 2 days of having symptoms. So thus far, we base it off when you have symptoms, and we look back, it could be 14 or down to 2 days in which you were exposed. So it's really hard to know where you got it from, but it almost doesn't matter because you can't give it to others until you're sick yourself. So I don't have it, I don't think, but if I did, you're not at risk for it if I'm standing in this room and not sick with it. And this is part of the reason why we think kids are okay. So the rate of infection for kids is fortunately very, very low. They may be carriers, we don't quite know that, but they just don't get ill from it. As a result, they're unlikely to spread it.
How available is testing right now for someone who wants to come in and they're feeling sick and want to get tested?
So testing is performed at the state lab, all right? Tests are collected at many different sites. They can be collected at a clinic, they can be collected in the emergency department, in immediate cares or urgent care clinics. Testing involves 2 swabs, 1 in each nostril and 2 swabs in the throat. So a total of 4 swabs have to be collected and sent off to the state lab. Testing is available. They assure us at the state level that there's plenty of test kits available. They haven't turned anybody away for testing at this point. They've actually, in the last 24 to 48 hours, liberalized testing. Previously, there was a requirement of travel or exposure to known contact cases before they would test. And now we know that they will test if we've ruled out every other reason for a respiratory illness and the symptoms match, and we will test for it.
So you guys rule out every illness before you test for
We rule out
coronavirus?
every illness that we can test for. We rule out influenza, we rule out other respiratory syncytial virus. We have viral panels that we run to make sure there are other viruses that aren't present. We rule out mycoplasma pneumonia, we rule out other bacterial pneumonia, and we look at those and we make sure none of those are present. If none of those are present, then we generally will test for it.
If
one of those is present, we won't.
How long does it take for those tests to conclude and then you get to the coronavirus and you can test for that after?
Generally about 24 hours.
24 hours. Are they staying at the hospital when they're being tested for those other diseases and viruses?
No. So there is no reason to place anybody in the hospital who does not have an inpatient medical requirement. Just because you may have the virus or you may have COVID-19 illness, we are not placing you in the hospital. There's no medical indication to place you in the hospital unless you need medical care affiliated with that. If your oxygen level is low in your blood because your illness is more advanced, you'll come in the hospital and get supplemental oxygen. There's no treatment for this virus. So all the treatment is supportive. So if you require supportive care that can't be delivered in the outpatient setting, then we'll admit you to the hospital. We do not admit people to the hospital pending tests. Same with the COVID test. If we believe you don't have this influenza and you don't have another reason, and we're suspicious for COVID-19 and you're in the emergency department, we may test you and then we'll send it off to the state and we'll send you home and tell you to self-quarantine at home until the state contacts you, until we'll contact you back with the results of your test.
It's worth noting that the grand majority of cases will be mild. The estimates are about 80% are going to be a mild illness. So most of this presentation is going to be on the outpatient side, just the same as it was with this index patient. So it doesn't mean everybody needs to get tested, just as Dr. Farrell was alluding to. And we see common illnesses all the time. This is the Pine Belt, right? How many of you have allergic rhinitis or are wondering if you have COVID right now? So we have to differentiate what those things are. And in the outpatient setting, we do rapid flus, which come back within minutes, and then we start using our clinical judgment. And in this case, because of this person's travel history and the symptoms being flu negative, we were able to proceed on very quickly, fortunately.
What measures do you guys have in place if someone comes in the emergency room and has it and they don't know it and possibly exposing other people in the emergency room?
So the way our processes are set up right now is when a patient comes into the emergency department, if they have no thought that they might have been exposed to this virus or they might have it, then when they present for triage at our triage window, they'll get asked questions. They'll be asked if they have a fever. They'll be asked if they had any travel history. If they have a fever and a cough and shortness of breath, we will ask them to put a mask on. And then we'll take them over to a room and place them in a room where they can't expose other people. And then the care providers who will provide care to them will put on their masks before they go in to see them. So that's how we're currently handling that. What we're asking, if someone is ill enough at home that they feel they need to go to the hospital, they've been educated and they think, wow, I hope I don't have COVID-19 illness, but I have fever and shortness of breath and I know someone who does. We're asking them that they call ahead, let us know, and we'll actually meet you out front, put a mask on you before you even come into the facility. All right, and then escort you to a room where we can make sure that you're not at risk of exposing other people.
So do you have test kits on hand right now, or are you having to contact the state health department to get those?
We don't run the test here. So we have viral swabs. We have swabs here that we do for other testing that are present in our facility. They're present in urgent cares and clinics around town, just like they do for flu swabs. I mean, they do a nasal swab and a pharyngeal swab for many different kinds of tests, and it's the same kind of kit. So we collect those swabs, we send some documentation with them to the state, and then the state does the test there.
So about how long is that process from the time that you swab a patient to then getting a?
24 to
About
48
24
hours.
to 48 hours.
Yeah.
You mentioned someone ill with virus and COVID-19 illness. Can you explain the difference between the two?
I'll let you.
Okay, so the name of the virus officially is SARS-CoV virus 2. So the illness is called COVID-19. So we just made up these names, but just to be particular, the virus is SARS-CoV-2. SARS coronavirus 2. The illness is COVID-19. We like that in medicine. We do things like that.
So what's the best line of defense for the community? People are reacting. Right now, you go to Walmart, people are buying up stuff. What should the community know right now?
I think the best line for the community is the same thing you do in flu season. Wash your hands, avoid contact with ill people, try not to touch your face because this virus is transmitted into your body through your facial contact. If you have contacted viral excrement on your hands, you could get it into your system through touching your face. So we ask people to avoid close contact with people, avoid crowded areas, and that's why you see a lot of times we're changing our social life so that we're not in so many crowded areas. Avoid contact with anybody you know to be sick. All right? If you're sick, don't go visit people.
Does that include contact lenses too?
So you can touch your face if your hands are clean. So the reason we ask you not to touch your face is because you just haven't cleansed your hands all the time. But when you're at home, you wash your hands, and you have to put on your makeup, put on your contact lenses, that's okay, because washing hands is the gold standard. You will get rid of this virus by washing effectively. Then you can do whatever you normally do. Just don't do it out in public when you're out in the middle of a press conference.
It's known that this virus impacts elderly patients more. Should elderly population be taking more extreme measures, extreme precautions because of that?
Yes, so we're not sure it infects them more, but it affects them more, so it makes them more sick. And so we're asking elderly people to really avoid mass gatherings. So this was the recommendations of Dr. Dobbs and Byers just an hour ago. So they said to try to limit all mass gatherings of 250 people on up in general, try to cancel them. And they asked elderly people just to not attend any of those of any significant quantity. So yeah, they have to take extra precautions.
Is that the same for anyone with underlying issues?
Correct.
And other chronic health diseases.
Correct, especially lung diseases.
And do you recommend that they not go out like to restaurants and things like that?
Okay, so that's a really, really great question. So if you're not ill, you don't have to avoid living your life. But when this thing spreads, it spreads because we pass it to one another. So we're gathered here in a room with a bunch of people because it's important that we're here and we get this message out. If we were just here to chit chat, we probably shouldn't gather like this. So the recommendations are to be wise with when you need to gather. Is there a purpose for this? Is it a business purpose that's substantial to you, or is it a public health purpose that's substantial to us? Otherwise, you don't need to go in places where you're congregating and potentially spreading disease. Does that make sense?
Do you know if the person who was diagnosed had been anywhere else when he came back to Hattiesburg?
So, we have to maintain confidentiality when we talk about this. But the exposure we know is limited to travel to South Florida and then having come back here for this incubation period.
Do you know
Was
what
that by
airport
car
they
or
flew
by
at?
airplane?
Airplane.
Do you know which airport?
I want to say Gulfport.
Gulfport. And it's important to know, someone who may have been exposed, who passes through and walks through Gulfport's airport, does not put other passengers at risk in Gulfport's airport. All right?
So it's still safe to fly.
Absolutely.
So remember, this patient did not have symptoms at that time. So it's not as if everybody that's come into contact with this patient that became ill on Tuesday is now at risk. That's not the case. If you were exposed to this person and now you are ill, now we start thinking maybe you have this virus.
So even if there's no symptoms, you can still pass it along, correct?
Maybe, we don't quite know. We have to kind of figure this one out as it goes. There are some illnesses like that where you have carriers that don't manifest in symptoms. We don't quite know, probably not, but we'll have to wait and see on that.
You referenced this incubation period in regards to the trip to Florida, but the incubation period for this virus is approximately up to 14 days for about 99+% of the people who end up showing symptoms. So is it also possible that he could have obtained this virus before going to Florida?
Well, let me clarify those numbers a little bit. So the range is between 2 and 14 days. The median is 5.1, which means 50% of the people have greater than 5.1 and 50% of the people have less than 5.1. So on average, it resides around that 5-day period. So if we're trying to index who's at risk and when this was acquired, it's really hard to do because we know it's infectious when you have symptoms. We do know that. So based on that, Tuesday when the symptoms occurred, going forward, people are at risk that are exposed to this patient. Prior to that, it's really hard to judge. It's really hard to guess. Does that answer your question?
Oh, yeah.
He's in self-quarantine, right?
Correct.
How effective is that?
Wow. So
It's the most effective.
Very, very effective. Yes. Yes.
If he's in his house and no one comes around him, he can't make anybody sick. All right? It's not leaving his house, going out into the neighborhood, and infecting someone who walks their dog down the street.
Yeah.
That's not what happens. It's not that kind of an illness.
This is the great thing about living today. So you can order a waiter, they can put it on your doorstep. You don't have to interact with the other humans. You can stay fed and hydrated. So we're fortunate in many aspects.
Has Forrest General been monitoring his case, or is that handled by someone else?
We are.
And how has he been doing it?
Without revealing private health information, good. So patients doing well at home. We're checking in with them several times every day.
We're seeing a lot of cancellations, whether it's sports, specifically sports, NCAA tournaments, conference tournaments. What about non-sport events like going to church or temple or something like that? Do you recommend that folks attend church this Sunday, or should they stay home?
I will piggyback on my colleagues at the State Department of Health, Dr. Dobbs and Dr. Byers, who just spoke on this. Yes, do not go to church. Do not go to mass gatherings that are not absolutely necessary. That's the recommendation, especially at that magic number of 250. Not quite sure how they arrived at 250, but my interpretation of that is if you don't need to be in a mass gathering, God will forgive you. That's my opinion.
Question, with anyone that's diagnosed with this, is there a time where they may possibly shed this after they're already feeling a little bit better?
We don't quite know. So this is an evolving thing. The reason why we're all here talking about this is the first time humans have been infected with this. And whenever we have a situation like this, the illness is more severe because we haven't built up antibodies yet. When we see this again, it won't be as bad as it is this time because there'll be cases like this that have had antibodies built up and it won't spread as quickly. A plug for vaccinations, this is how vaccines work. This is why we're able to battle these diseases. If this was influenza, we could really get after it because we have a vaccine for it. This illness would be a whole different story if there was a vaccine available for it. And it will be when there is a vaccine available. So to answer your question, we don't quite know. So we're taking an abundance of caution. So that's why we're saying 14 days. Even though most are at 5.1 day incubation, we're saying try to stay away for a couple weeks.
Currently, the policy at Forrest General for employees who are sick is if you call in sick, you first use your vacation time, which seems to be somewhat discouraging for people who don't want to give up their vacation time and might show up for work when they otherwise should stay home at a time like this. Is that policy being rethought during this time, or is that something that?
Well, I don't think now's the time to address employee policy and human resources policy. I'm not sure this is the right venue for that. So if an employee feels sick, they use their sick time, and they have sick time. And we encourage employees, especially in patient care areas who are ill, to not come to work in the event they just feel well. They're not penalized for not coming to work. It's simply sick time. So you're encouraged not to come to work.
Yeah, my medical doctor doesn't give me the expertise to answer that question. I apologize.
So if someone gets this, recovers, have you guys seen anything throughout, I mean, you guys talked to other doctors, obviously. Has there been any knowledge of whether or not you can get it again, or like, how does that work?
So reinfection has not been something we've heard anything about, and it's unlikely based on the way it occurs in other illnesses. So every time you get a cold, it's a little bit different virus than the colds you had previously because you've developed antibodies against that previous virus. So it's very unlikely that you're going to get sick from the same illness. Very unlikely that you get influenza twice in 1 year. You could because there's different strains, but it's very unlikely from the very same strain.
Okay, I think we're going to go ahead and wrap this up. Thank you so much, and we're going to introduce Hattiesburg Mayor Toby Barker to come forward and make his remarks, and he's going to be joined by the President of the Forrest County Board of Supervisors, David Hogan.
Good afternoon. This morning, as was mentioned, Dr. Thomas Dobbs, our State Health Officer, gave guidance on how best we can slow the spread of COVID-19, and I want to appeal directly to our residents in both Forrest and Lamar counties. He encouraged people to be cautious of attending large gatherings, particularly those over 250 people. Specifically mentioned were people over the age of 65 and people with underlying or chronic health conditions. So if you are over the age of 65, or if you have an underlying or chronic health condition, I would strongly encourage you to consider limiting your presence where there are large assemblies of people, or gatherings where you are in confined spaces with others. Use good common sense when it comes to choosing to attend a concert, church, or other event. And we've begun conversations with pastors, letting them know that they need to communicate this to their parishioners. And many are looking at alternative ways of worship, such as broadcasting something online. And to our many organizations who host events and festivals and all the things that make it fun to live in and visit our city, I want to ask your cooperation toward postponing or canceling events for the time being where there might be over 250 people in an area at one time. We will be publishing a list of those events that have been postponed or canceled at hattiesburgms.com/coronavirus. Organizations can also send us their cancellations. We'll be glad to post them and get them out to the public. This situation will evolve as days and weeks and months go by. This isn't a single event like a tornado or a hurricane. This is going to be ongoing, and we know that. And we encourage everyone to simply use common sense and be mindful of your risk of exposure. You will likely see in the coming days both the City of Hattiesburg, Forrest County, and Lamar County take formal steps to better access potential state and federal resources for this situation. Know that preparations for this did not begin yesterday when the first presumptive positive case showed up. Our counties, EOCs, school districts, universities, and colleges, nursing homes, and healthcare organizations have been preparing for this for some time. And we have had many conversations across disciplines and governing authorities to share information and coordinate effort. Yes, this is a challenge. Yes, there will likely be more positive cases in the days, weeks, and months going forward. Yes, this will inconvenience us and disrupt how we go about our daily lives. But we are no stranger to tough situations in this community. We have first-class healthcare institutions, and we have world-class resolve. So let's be smart, listen to our medical community, and make good decisions to keep ourselves and our families safe and healthy.
We are blessed to have the most premier healthcare providers in our region. So if you start showing symptoms, fever over 100 degrees, shortness of breath, coughing, contact your primary caregiver. Let him know or her know what's going on, and they will direct you how to be treated properly. Let's be smart. Let's avoid large gatherings. Let's wash our hands frequently. Avoid touching. And as the mayor mentioned, we have resources available to us through the state and the federal government. And in order to enact those resources, it's likely we may have to declare a state of an emergency or implement our pandemic plan. Don't be alarmed by that. It's mainly for gathering the resources that are available to us. It does not necessarily mean that anything is spreading or getting worse. And time will take care of this. It's likely that it may get worse before it gets better, but as long as we're smart, we'll overcome this. Thank you.
Thank you to all of our speakers today. We do have additional information on our website at foresthealth.org. We also have links to the Mississippi State Department of Health, the CDC, and the World Health Organization, so you can visit our website for that. I'm sure that some of these speakers today would entertain doing some one-on-one interviews if you didn't get all of your questions answered during their presentations. Thank you for coming today, and everybody wash their hands and do high, fist bumps, no touching. Thank you.